Hey everybody, welcome back to Y Chiro. Today I'm going to be giving you the $1 million stretch. This is the best stretch that you can do for SI joint or sacroiliac joint irritation. The sacroiliac joint is a joint that's right here on the back. A lot of people call that the hip joint. It's not quite the hip joint, but that seems to be what people call it the most. It's more the pelvis. When you get pelvic irritation, it'll nail you right there, and sometimes it'll get you up the side of the back. The Quadratus Lumborum is a muscle that comes over top of the pelvis and goes to that last rib. It's involved in side-to-side bending and twisting. The Quadratus Lumborum is the main muscle that causes pelvic rotation. Whenever the Quadratus Lumborum spasms up, you'll kind of look snaky when you look in the mirror. Whenever that happens, it means you've got a really bad Quadratus Lumborum spasm. I'm going to call it the QL for short. Now the QL is one of the most important muscles to stretch. This is an extremely easy stretch. It works amazing. So I'm going to show you how to do that. Very simple. What you do is you find something to measure with, and you're going to measure against a wall. You want to find a nice, smooth, flat surface. What you're going to do, I'm going to use this really bright pink pen. You can use anything, piece of tape, slat in the hardwood. We're going to put it down on the ground about 6 inches from a wall. So pretty easy. Now, with this stretch, everybody always thinks more is better. Never go past 9 inches, even though it might not feel like you're doing anything at all with this stretch. Too far is not beneficial. What we're going to do with our measuring device is put our feet together right against what you're stretching, or what you're measuring against. Feet together, stand up nice and straight. Take your arms, cross them over your chest. Pull your shoulders in so they're not so terribly far out. Then we're going to drop the shoulder into the wall and drop our hip into the wall. Now, when you're really tight, you're going to torque when you go into that wall. When you're tight, you're going to kind of twist into that wall. What you want to do is make sure that you're parallel to the wall. You want to hold that stretch for 20 to 30 seconds. That's it. It's that easy. Don't bounce against the wall. Just hold it. Leave it there. The key with this stretch is we have to do it exactly the same distance on both sides. We have to elongate the shortened muscle, the shortened contracted muscle. So once you're done with your 30 seconds, stand up straight. Then we're going to turn around and do it on the other side. So we're going to stand feet together against what we're stretching. Cross your arms over to your chest. Cinch the shoulder in. Drop the shoulder to the wall. Drop the hip to the wall. Make sure you're not torqued. Make sure you're perpendicular to that wall. And hold it for 30 seconds. Now, this stretch, when you initially do it, if you have a lot of pelvic pain or Quadratus Lumborum pain, it might initially hurt you a little bit. It will probably throw you out initially. What I want you to do is do this often. Do it 3 times in the morning, 3 times in the afternoon, 3 times in the evening. The more you do it, the better. That will loosen you up. Remember, initially when you do it, it might hurt you. Keep working your way through it. Start in closer to the wall, 4 inches, and work your way out. I hope that stretch helps. As always, give us a like and a comment, and subscribe to our channel. Thanks, and have a great day.